I'm Dr. Izadi, and I have two practices in Los Altos and San Ramon. I'm very excited to have you during our virtual event. I encourage all of you to stay toward the end of the event and submit your questions. I'm here to answer any question you might have about Daxxify. And also there is a special price for people who attend the event. Everyone who attends this event tonight can have 20 units of Daxxify free of charge with the purchase of 2 areas. And also there is one lucky person who can have 100 units of Daxxify free of charge from the raffle. And we will notify you through an email who would be that lucky person. And thank you so much for attending this event. So Daxxify is a new neurotoxin that I believe is a game changer in the field of neurotoxins, and it's different from all other neurotoxins in so many different aspects. First of all, it's made in the US, and it doesn't have any animal protein, it doesn't have human albumin, which you can find in any other neurotoxin. And because of its specific structure, it has peptides covering the toxin to make it more stable and attached to the end of the neuron more efficiently. And there are mainly 3 factors involved in specifying Daxxify. It's efficacy, duration, and safety. So anyone who uses any other toxin is a good candidate for Daxxify, and you can inject Daxxify in any area that we use any other toxin. In the face, mainly in the frown line, bunny lines, forehead, crow's feet. For people who grind the masseter muscle, we can define the jawline better by injection of Daxxify, the chin area. In more than half of the patients who had the trial, it lasted more than 6 months, and in some patients it lasted more than 9 months. And another specific thing about Daxxify that is exclusive is that they did a study on around 2,700 patients, and they had patients who had severe lines changed to mild, and people who had moderate lines changed to none, which is again a game changer, because there is no other neurotoxin with the same results and the same number of patients in the clinical trial. I already tried Daxxify on myself and a few patients, and already know that it's amazing, and it's completely different from any other neurotoxin. The experience that we had with Daxxify, you could see the result faster than other neurotoxins. Some of my patients had improvement even the next day, but the maximum result can be seen between 2 to 4 weeks, and we can have follow-up between 2 to 4 weeks to see if the patient needs some touch-up. And also, again, more than half of the patients in the huge clinical trial that they had the result lasting for more than 6 months, and some of those patients had the result lasting for around 9 months. So of course, like any other treatment, there are always a very small number of patients who have the result less than 6 months or more than 9 months. Those are at the either end of the bell curve when we do the study. Thank you all for attending this event. Please check your email because we will notify that one lucky person who won the 100 units of Daxxify tomorrow through email, and also you will receive a text message regarding the event. If you respond yes, someone will contact you to make an appointment for either consultation or treatment, and that way we can lock the special price for the event for you. And I encourage you to stay until the end and ask any question you might have, and we will go through all your questions and answer your questions. Hi everyone, I'm so happy to see all of you here tonight. Thank you so much for spending your evening with us. I'm here to answer any question you have about Daxxify or RHA Filler, and hopefully by the end of the event you learn something new, and I'm very much looking forward to seeing you in my office. So I started using RHA Fillers almost a year ago, and for Daxxify, I started Daxxify a month ago, and because I had great results with both products, I stopped using any other filler in my office because RHA Filler has 4 different concentrations, and depend on which area you want to treat, and depend on the patient's skin condition, we can choose a different type of RHA. And all my patients are very happy with RHA Filler, and I think one thing about the RHA that makes it standing out is very natural results, and that's why everybody loves it. And regarding Daxxify, I think definitely Daxxify has a lot of benefits over any other neurotoxin, and my hope is that in near future I only offer Daxxify as a neuromodulator in my office, and although I started using Daxxify in less than a month ago, more than 80% of my patients already switched to Daxxify, and I had great results and great feedback from my patients. I have a lot of before and after pictures for Daxxify and RHA fillers that unfortunately I wasn't able to share here, but I will post those on Instagram and my website for you to see. And again, I'm so excited to see all of you here tonight, and we can go over the questions and answer your questions. So the first question is that how much is Daxxify per unit? I can't wait for the consultation. I can't wait to see you either. So Daxxify in my office is $8 per unit. In other practices, they charge between $18 to $20 per unit. So because every 40 units of Daxxify is roughly equal to 20 units of Botox, and in my office, Botox is $8 per unit. So if you calculate it, it's like twice more expensive than Botox. But considering the duration of the effectiveness and all other benefits that Daxxify has, it's worth the money you pay. So Daxxify is a very good neurotoxin neuromodulator for everyone who can afford it. Does clear and brilliant or laser treatments impact the effect of neurotoxins? No. It's neurotoxins, Botox, Daxxify, Dysport, Xeomin, they all block the release of acetylcholine through the end of the neuron to paralyze muscles temporarily. So if you get laser treatment, you have to wait until all the swelling and edema is gone and then receive any type of neurotoxin like Daxxify, because when you have too much swelling, the neurotoxin might go to muscles that you don't want to paralyze. Another question, are you able to get both Daxxify and RHA at the same time? Yes, if you treat different areas. If you want to treat the glabella, frown lines, forehead, you can use Daxxify because I don't inject fillers in those areas. But usually patients who get filler in their cheeks, I prefer not to do the Daxxify or any neuromodulator in their crow's feet at the same time. And another question, what areas we can use Daxxify for? So Daxxify is like any other neurotoxin. It's FDA approved to treat frown lines like any other neurotoxin, and off-label we can use it in many other areas. There are three main areas on the face I treat: is frown line, forehead, crow's feet. In some patients, when they grind and they have bulky muscles, masseter muscles, I also inject it in the masseter muscle to prevent grinding and damaging their teeth, because grinding can cause also gum recession. And also another cosmetic benefit of it is making the face more narrow for people who have a very square face and they like to have a more narrow face. In other areas, you can use Daxxify like any other neurotoxin in the platysma bands at the jawline to make the jawline more defined. And for hyperhidrosis, also we use it for people who have very bulky calf muscle. We can also use that. For people who have muscle spasm in their neck and their shoulders, that's also another indication to do it. What can I do before appointment to help prevent bruising? So when you sign the consent form, there is a long list of supplements and medications that you should stop taking at least a week, and preferably 2 weeks before your appointment. If you go to your consent form, you can see the list. And if you prevent taking those supplements and medications, that helps a lot to prevent bruising. Can I get filler in my necklines, necklace lines? So again, Daxxify is like any other neurotoxin that paralyzes muscles, and they cannot replace volume. If you have lines because of volume loss and collagen loss, there is no neurotoxin replace that, and you need to have filler or biostimulators such as Radius to fix that. If I have never had filler in my lips, which RHA is a good one? So if you want to look very natural and just hydrate your lips, I use Redensity, which is RHA number 1, and it's the very soft filler. which I usually use for smoker lines or barcode lines on upper lip, and also on the lips for patients who don't want to have any increased volume and they just want to hydrate it. And then depend on how much volume loss you have and how much volume you want to add to your lips, we can choose either number 2 or 3 for lips. Are the units the same as Botox? So the amount of toxin in 20 units of Botox is 0.18 microgram of botulinum toxin A, and it's the same amount as 40 units of Daxxify. So 20 units of Botox or Xeomin are roughly equal to 40 units of Daxxify and 50 units of Dysport. Yeah, so I answered these questions. How long after laser should I wait? We wait until all the swelling is gone. Can I get both filler and toxin together? If it's not in the same area, yes. Yes, we can use it for hyperhidrosis. And I just got this for it. How long should I wait to try Daxxify? Whenever the effect of the Dysport is gone, you can try Daxxify. So there is one important thing that I need to make clear tonight. When we say, for example, Dysport lasts for 4 to 6 months, it's not the same for every patient. The same for Botox. We say Botox lasts 3 to 4 months. There are some patients who have the effect for less than 5 weeks. So every patient is different, depend on how long you've been using the toxin, which type of toxin you've been using, what your skin condition is. And even for Daxxify, I have some patients that the next morning they send me pictures and they text me and they say, oh, my face looks great and all the muscles are paralyzed and frozen and I look great. And today I had one patient who sent me pictures and videos from herself, and she said she had the Daxxify a week ago, and she said, I still can move my muscles in the glabellar area. And she also sent me a picture of a patient from, I guess, Daxxify website that in 2 to 3 days she was completely paralyzed. So again, it's not the same for every patient. Some patients in 1 day respond, some patients 3 days, some patients 2 weeks. Usually the follow-up and touch-up is after 2 weeks, 2 to 3 weeks. We can see the patient to see if they need any more units in some areas that are still not paralyzed. And also some patients don't like to be completely paralyzed and they still want to have some movements. So again, every patient is different in terms of the amount of toxin that they receive and in terms of their response. I have used Xeomin before. How does this product compare? So Xeomin is also a neurotoxin that doesn't have extra proteins that the bacteria produces. So botulinum toxin bacteria produces some extra proteins to protect the toxin when it gets to our GI tract. And that's where we get the disease from the toxin. But we don't need those extra proteins to have the aesthetic effect of botulinum toxin A. And in the past, Xeomin was the only pure form of neurotoxin. And whenever my patients were asking me which one of these you use yourself, I would tell them that I use Xeomin because I don't want to develop antibodies. And I've been using toxins since I was 35. And now I only use Daxxify for myself because not only it's a pure form of toxin, but also it lasts a lot longer than Xeomin, and it has those peptides that can help to improve the quality of the skin. And I noticed in before and after pictures that they had in the training session from many patients that involved in the study, the quality of the skin and the skin condition also improved after using Daxxify, which is not something I see with any other neurotoxin. So there are many benefits and advantages when you use Daxxify over any other neurotoxin. But again, not everybody's the same. The duration of the effectiveness is not the same in every patient, and the amount of time that you need to wait to see the result is also different in different patients. How much does it cost? Again, it's in my practice, Daxxify is $8 per unit. When will I see my final results? I would say we should wait for at least 2 to 3 weeks. But again, many patients in 1 to 3 days, they see final results. Have you tried it yourself? And what do you think? Yes, I was actually one of the first people who tried it in my own practice. I have a neck problem and shoulder pain. So in the past, I used to inject Xeomin, and honestly, after 1 month, the effect was gone, and I had to do it again. And when I tried Daxxify, not only it started working extremely fast, but also I can tell that it's a lot stronger than Xeomin that I used to put in my neck and shoulder. And also I use it on my face. As you can see, I have a crooked mouth today because this is another thing I wanted to explain to all of you. In our body and our face, the muscle strength is not the same on right and left side. So when we inject neurotoxin, we put the same amount in the same symmetric injection points on our face. But for example, in my face, my left side is stronger than the right side. So when I injected the Daxxify in my DOA, this side still needs a little bit more to become symmetric, and it's not a big deal. It can happen in any patient because, again, the muscle strength is different in right and left side, and if we inject the same amount of toxin in the same symmetric area, we might end up having some asymmetry, which is very easy to fix. And I'm not worried about this, but it's unfortunate that this happened during my event. And when you come to see me in my office, you will see that it's symmetric again, because it's very easy to fix it. What makes Daxxify different from Botox or Dysport? So the main difference is the structure of the toxin. All these neuromodulators are made from botulinum toxin A, but in Daxxify, there is no human albumin. All other neurotoxins have human albumin, including Xeomin. And Daxxify doesn't have any protein from animals or human. And it's the only neurotoxin that they used peptide-enhanced science. And the way that it works, the toxin itself has negative charge. And the end of the neuron also has the negative charge. So when they cover the toxin with 35 amino acids with positive charge, it acts like a magnet and connects the toxin to the end of the neuron. So this helps to have faster effect, longer lasting effect, and also prevents some of the toxin to wash out because it was not able to get attached to the end of the neuron. So that's why it works better, faster, and stronger. So I hope I answered all the questions. Let me make sure there is no other question to answer. So again, in every area, typically we use like 20 units of Botox for a frown, forehead, or crow's feet in each side, 10 units of Botox, and you multiply it by 2 to find out how much of Daxxify you need. So there is a question about the differences between RHA versus Juvederm. So RHA fillers are cross-linked in a different way. And the way that they cross-linked RHA fillers, they look more like our own hyaluronic acid, and that's why it looks more natural. So I think the main benefit of RHA filler is that it looks very natural and it moves with your muscles. So when you have RHA filler in your face and you smile or move your muscles, you don't feel like there is something foreign in your face and it doesn't look fake. What is the difference between RHA and Sculptra? So Sculptra and Radius are biostimulators, meaning that they stimulate your body to produce collagen. They are not hyaluronic acid filler. That's the main difference. And it's just a different category of rejuvenation. So for people who want to stimulate their own collagen, Sculptra and Radius are the ones to use. How many days should I wait between doing RHA to my smile lines to do Daxxify to my crow's feet? Again, as long as you treat different areas, you can use Daxxify and filler at the same time. There are some questions that are just repeated and I already answered. Yes, Daxxify is a neurotoxin neuromodulator like Botox, Dysport, and Xeomin, and RHA is a hyaluronic acid filler. Does Daxxify help with eye bags? No, there is no neurotoxin helping with eye bags because when you have eye bags, there are 2 reasons for that. One, there is accumulation of fat pad under the eye, and the only way to fix it is surgical removal of the fat. And the second reason is collagen loss. So you need to do things to produce more collagen. And in fact, in some patients, when you inject the neurotoxin in the eye bag or under the eye, it might make it worse because, again, it's not replacing volume or producing collagen. Yeah, I think I answered all other questions. Again, thank you so much, everyone, for attending the event and spending your evening with us. I'm so excited to see you in my office, and I promise you, you will see symmetric lips when you come and see me. So as I told you, there is a special price for people who attend the event. When you get a text message after the event, if you type Pristine, you will lock the price, and I will see you for consultation or treatment, and you will get 20 units of Daxxify free of charge if you treat 2 areas, and one person will get 100 units free of charge, and you will be notified tomorrow if you're the one who has 100 units free. And again, thank you so much for attending, and I'm looking forward to seeing you in my office. Don't forget to answer the text message when you get it, and benefit from the special price for the event. I'm looking forward to seeing you. Thank you so much. Bye.